Hi, my name is Breon Spate, and my at risk population is the African American community. First, I would like to talk about the background on the African American culture. African Americans, one of the largest of the many ethnic groups in the United States, enslaved people who were brought from the African homeland by force to work in the New World. Their rights were severely limited, and they were long denied a rightful share in economic, social, and political progress of the United States. The distinct identity of African American culture is rooted in the historical experience of African American people, including the Middle Passage. The phrase Black is beautiful refers to a broad embrace of Black culture and identity. It is called for appreciation of the Black past as a worthy legacy. Majority of African Americans live in 10 states. New York City and Chicago are the cities with the largest Black population. About 6 in 10 people reported as Black or African American, along or in combination with other races, reside in 10 states, where nearly half of the United States lived last year, according to the new Census 2020 analysis. Why is the African American community considered at risk? 1. Discrimination. 2. Healthcare access. 3. Education, income, or wealth gaps. 4. Housing. 5. Systemic oppression. And 6. Incarceration rates. Discrimination exists in systems meant to protect well being or health. Examples of such systems include healthcare, housing, education, and the criminal justice system. Healthcare access. Some African Americans are most likely to be uninsured and can be limited by other factors such as lack of transportation or childcare. Education. Unequal access to high quality education for some racial and ethnic minority groups can lead to lower high school completion rates. Housing. Living in crowded conditions and just the low income family housing. Systemic oppression is a form of violence that places or keeps people of color in conditions of hunger and poverty through the structural withholding of resources and opportunity. Incarceration rates, as you can see in the U.S., Black and Latino people are imprisoned at higher rates than white people. Black people are 6 times the rate, and the Latino people are 3 times the rate. How does society view the African American community? Mostly it's negative views because they see Black people as aggressive, violent, uneducated, or they see us as criminals or people who just don't belong in this society. The fight of African Americans is to have a racial equality for all races, especially their white counterparts in America. The divide between Black and whites for hundreds of years, from the views of racial discrimination, boundaries to Black progression, and the prospect for change. Stereotypes are ingrained in the fabric of the United States and coincide with the institution of slavery. The stereotypes of African Americans, particularly males, has had a negative impact on African American families and communities. Their beliefs are affecting educational outcomes, employee opportunities, social economic status, and dismantling of African American families in the communities. The only positive views African Americans get in the society is when we're playing sports, football, basketball. That's usually what they say we're only good for when it comes to being in the society. Most of the time, it's negative, bringing us down because most people feel like we don't belong. What boundaries do African Americans face? Number one, discrimination. The stereotypes placed on Black people have affected them in so many ways, including employment, healthcare, and education. Two, medical mistrust and racial disparities. Disparities in health coverage, chronic health conditions, mental health, and morality. Decades of systemic inequality in American economy, housing, and healthcare system. Racial discordance, which is basically patient and provider relationship. So I work at a hospital, so I actually do understand this one because when I go in, my mindset is always to treat a patient how I would want to be treated, regardless of the race, the gender, the sexuality, or religion. I'm gonna always treat my patients the same, regardless of who you are or what you identify as. That's what I'm going to always go by. But there is people in healthcare who do not always follow that same rule or that motto. As an African American, I still fear for my life regardless because I am a healthcare worker. There are some people who just don't accept who I am, or me as a woman can be something that can affect my healthcare. It's really sad to know that just because of the color of my skin, I'm going to always be treated different regardless of what I do. I could be a millionaire and I would still be, treated different from somebody who is homeless, or my other racial groups, white, Latino, things like that. So it's really hard. It's really hard to understand why people would treat, patients or just people in general like that. Four can be poor communication. Um, Different ways to communicate with this other races. You just have to learn how to communicate with African Americans just to be able to understand why they are what they face and what they're fighting for altogether throughout their life. We wake up every day fighting for our lives, for equality, fighting for children and generations, along the way to be able to be treated the same as all people. The needs for this population. One would be resources for low income families. There are a lot of African Americans who are low income families who need the help from the government, or they just don't make enough money with not having the equal opportunities when it comes to education, to be able to go to high school, or even if they did complete high school, be able to go to college to provide for themselves and to, have a better life for their children if they do have children at the time. A lot of low income families need the resources when it comes to be able to provide for themselves, not only just for them, but if they have children and things like that. Two would be healthcare coverage programs. A lot of families do not, or just people in general do not have insurance. Most people have to choose whether they're going to get health insurance or they're going to keep the lights on, type of thing. It is important to have these resources, not even if it doesn't pay for all of their healthcare expenses, but some people, they do have programs, such as like Medicare and Medicaid, but most people aren't approved for such things. Like, there are a lot of qualifications that you would have to have, or, requirements to be able to, have those type of coverages. Three, ways to improve health disparities. Just having the equal opportunity when it comes to your health. I want to know that if I'm going to the hospital, I'm still going to get treated the same as if a white person comes into the hospital, they're going to get, we're going to get the same care. And also just the education of healthcare workers to know that they have to, because they chose to be in the field that they are, they're going to still treat the person the same, regardless of how they feel on the inside. Leave their political differences, religious differences, the way they feel about, people's sexualities, genders, anything like that. They keep that at the door and they provide the care that they're supposed to. The resilient factors would be confident, community support, culture, connection, and personal skills. Being in the African American culture, that I do know that we use our hardships and what we have went through to be able to fight for our human rights, to fight for the next generation to have those human rights and be able to give them the confidence and the skills to be able to fight more and more for their human rights. Events in history that have greatly influenced this at-risk population would be Brown versus Board of Education in 1954, Martin Luther King's I've Had a Dream speech in 63, Selma's to Montgomery March in 65, Black Lives Matter movement being founded in 03, Barack Obama becoming the 44th president, but also becoming the first black president of the United States in 2008. Kamala Harris being the first African American woman VP elected. This is a great thing that came out of 2020 because of everything that has been going on, not just for African American people, but for women in general to know that we can also have a high position in this society and we can win. I hope that everyone watching this learned something about the at-risk population of African American community and also find a way to also help the community just become better. Thank you.